Thank you for joining us for the Johns Hopkins Government and Community Affairs Showcase Series, which highlights initiatives at Johns Hopkins and their significance in the state. My name is Delegate Arianna Kelly. I represent District 16 in Montgomery County. Johns Hopkins Suburban Hospital is in my district. I will moderate today's discussion. Today, we'll talk with Dr. Mihail Zibermint, Associate Professor of Clinical Medicine and Chief of Endocrinology at Suburban, and Monique Sanfuerites, Administrative Director of Community Affairs and Population Health Improvement, about the Diabetes Self-Management Program. Dr. Mihail Misha Zibermint is the Chief and Director of Endocrinology at Suburban in Bethesda, Maryland, and he is the Medical Co-Director of the Diabetes Prevention and Education Program in the National Capital Region. He established the Endocrine Hospitalist and Inpatient Diabetes Management Service at Suburban Hospital, and he helped save his hospital hundreds of thousands of dollars by reducing the length of stay of patients with diabetes. His specialized diabetes team won the Johns Hopkins Innovations in Clinical Care Award in 2017. Great job. Monique leads Suburban Hospital's health transformation and improvement commitment to the community. Improving quality of life, keeping the community safe and out of the hospital is at the center of day-to-day operations. Aligning hospital and community assets, as well as focusing on unaddressed identified needs, Monique links health partnerships, community initiatives, strategic affiliations, and collaboration with health coalitions, outreach activities, wellness programs, and corporate projects to address established health barriers, disparities, inequalities, including for diabetes prevention. Before we get into the discussion, I want to go over some logistics. The webinar will be recorded and it will be posted to the Hopkins at Home websites with captions included. Additionally, the questions and answers function has been enabled during this webinar. Please feel free to type questions there. We will do our best to respond to as many questions as we can in the time that is available. With that, I will ask Dr. Zibermint and Monique to tell us more about how they address Maryland's barriers to quality diabetes care.
Thank you so much, Delegate Kelly. Thank you, everyone, for joining us today. So my name is Dr. Misha Zibermint. I'm an endocrinologist and I'm endocrine hospitalist. As Delegate Kelly mentioned, I practice at Suburban Hospital. And unfortunately, I see mostly complications of diabetes. So in the next 15-20 minutes, Monique and I would like to share what do we know about diabetes in the United States and also in Maryland, and why we believe that this is a challenge and how we're going to tackle it together. So diabetes is extremely common. Remember that every 10th adult in the United States has diabetes, and it's total about 34 million of people. And unfortunately, 20% or 1 in 5 don't know that they have diabetes. For example, I just had a patient yesterday who came because of a hip fracture, and her sugar levels were discovered to be very high. And I was called in because she has diabetes. And the patient told me, wait. Nobody ever mentioned this before. How could it be possible? I never had diabetes before. So guess what? Every 4th person who walks at Suburban Hospital for any reason has diabetes. Why? Diabetes is extremely prevalent in our state. Remember, similar to a national region, 10.5% of adults have diabetes, so it's close to 500,000 people. And also, another problem, every 3rd adult in the United States has pre-diabetes or borderline diabetes. Pre-diabetes is a condition when your sugars are high, but not high enough to call it a diabetes. I'm constantly thinking about the cost of diabetes. Remember, in the United States, every $7 healthcare dollar is being spent on diabetes. The total cost of diabetes in the United States is more than $327 billion per year. That's right. That's probably the amount of a gross domestic product for a country the size of Portugal. In Maryland, the cost of diabetes is enormous. It's about $7 billion. And remember, it's really hard for our healthcare system because we have to spend more than 2 times more on people who live with diabetes compared to those who don't. And we are talking about close to $5 billion in the direct expenses. And of course, there's a loss in Maryland economic productivity because people develop complications. Some of those complications could be heart problems or kidney problems or even food ulcers. So the complications, which I mentioned a few minutes ago, are really playing an important role. Remember, people who have diabetes, they frequently develop heart disease. So that's why people who come for a heart bypass surgery, frequently the ones who have diabetes, and I try to see most of them who come to suburban hospital. Some of the patients have complicated pregnancies due to diabetes, and ultimately we prescribe more and more medication, which costs more. In the hospital setting, because of these complications, people stay longer. And of course, for administrators and for our healthcare system, we spend more money. So what do we do to decrease length of stay and prevent readmissions? I want to shift a little bit gears and introduce my colleague, Monique Sanfuerites. Take it from there. Monique, you're muted.
Thank you, Dr. Zibermint, and good afternoon, everyone. It's a pleasure to be here and to share our passion for diabetes. And as you know, very similar to what Dr. Zibermint mentioned, as we look at diabetes impact on race, in Maryland, diabetes disproportionately impacts specific populations based on income and education levels, race and ethnicity, geographic location, and access to healthcare. And as we can see from the data here, prevalence by race for diabetes is highest among Black, Hispanic, and Asian populations. And similarly, the mortality rate, again, highest among our Black, white, Hispanic community members. And so when we think about how we are addressing diabetes among our community, we certainly are keeping in mind what our next slide, Dr. Zibermint, the social determinants of health and diabetes. And so social determinants, for those of you, I'm sure you're very familiar, of health are the primary contributors to unfair and unavoidable differences in health status, including risk for developing diabetes and diabetes complications. So how might social determinants affect the course of diabetes in an individual and a demographic group or community? Much of what we are working with here in our community, and both at suburban and around Maryland. So if we look at that socioeconomic status, which includes education, income, and occupation, the neighborhoods and physical environments where our community lives, such as housing and access to the clean air or what might be toxic exposures. What does a food environment look like, which involves such factors, food insecurity, walkable neighborhoods where you can find fresh vegetables and fruit. Healthcare, of course, including access to affordable and quality care. And then very, very important is that social cohesion and support, that social capital to have an inclusive society where individuals do not feel isolated or discriminated against. This is something that everyone in an impactful environment to have that leverage, to have those resources is something that's very important. But if you are lacking all of these resources, may greatly have an impact on status and the ability of whether someone is experiencing or living with diabetes. Next slide, Dr. Zibermint. So with great pleasure and something that, an initiative that was really absolutely made possible by the state of Maryland and the HSCRC, of looking at that at status and the data that tells us of the where our Marylanders could really benefit from improving. We were granted with Johns Hopkins Medicine and the University of Maryland, the Baltimore, Maryland Diabetes Regional Partnership. And with those dollars, we are able to really put together what is a diabetes education and prevention program specifically for people with diabetes, and provide integrative and comprehensive approaches to diabetes care. What's important to know is that this work is going on across Maryland. What we find unique is what is going on in the Montgomery County community and what we are doing here at Suburban to address all of those needs, and bringing the ability to bring together a team that includes diabetes educators, the clinical expertise of our physicians like Dr. Zibermint, community health workers, the ability to integrate the services that we already have in health prevention and wellness under one infrastructure that wraps around the needs of our population living and experiencing the complications that may need to be addressed by diabetes with one-on-one education. And Dr. Zibermint is going to tell us a little bit more of what that clinical approach looks like. Dr. Zibermint?
Thank you, Monique. So first and foremost, remember that this diabetes self-management training, or I call it a lifestyle coaching, really is an evidence-based and it's a standard of care. So what does it mean, the standard of care? It means that the guidelines provided by the American Diabetes Association, the American Association of Clinical Endocrinology, and other organizations say that virtually every single person with diabetes should be referred for a diabetes self-management training or coaching. And why is that? Because by having a personalized plan, we know that people will improve their outcomes. Their sugar levels will get better. They may lose a little bit of weight. Their complications hopefully will be reduced. And it's really available to most of the people who have type 1 or type 2 or even gestational diabetes. So how does the journey for diabetes self-management training work? So first, step one, a referral can be done by any clinician, any provider, physician, nurse practitioner. What happens next, once the referral is being made and is being sent directly to our electronic medical record, a special healthcare team member will reach out to the patient and schedule an initial visit. And the first initial visit can be done virtually, as long as we have a computer or a phone or a smartphone, or it can be done in person, so people can come to Suburban Hospital, or we have other locations around Maryland as well. And we believe that most of the people are going to benefit from this program if we are actually coming back. So up to 10 hours of education, either individual and group, in the first year would be the most beneficial. And of course, patients are eligible for up to 2 hours of follow-up education each year indefinitely. The biggest challenge is step number 1 and step number 2, because we need to advertise the program and to convince clinicians to refer their patients. This program has been around for a while, but very few referrals have been done until we start promoting it heavily. And the second is, it's really hard to get people to the first appointment. Once they're getting in, they love it. And why is that? Because remember, it's really nice to spend up to 60 minutes face-to-face with an educator. We all know in modern reality, physicians spend quite little time with their patients, maybe 15, 20 minutes, 30 minutes. Those educators really take the time and spend one-on-one for maybe at least 60 minutes, and they are certified diabetes care and educational specialists. So what does it mean? That they are able to go over your diabetes medications, If you're using a continuous glucose monitor, it's a machine which checks your sugars continuously. They can help you to download the data and help you to analyze it. And at the end of the session, they will write their note and send it to your referring physician, to you, for example, to your primary care doctor or to an endocrinologist. And with that, Monique, would you mind talking a little bit about community health and wellness?
Thank you, Dr. Zibermint. It is the greatest pleasure to be able to bring together all of the services I had mentioned earlier of what Suburban does in community health and wellness, and with the extension of the regional partnership, so much more. And together, you know, we've looked at in our health needs assessment, for example, most recently, diabetes is absolutely identified not only as a community need, but also that prevalence of an outcome that is very much affecting our community, our patients, and our community at large, and bringing together an approach that is equitable in health, reducing those gaps in access to preventative services for our vulnerable populations, expanding access to care with the appointments and the ability for our educators to see patients with diabetes with that specialty component where they may not be able to have that in the doctor's office. And then the idea that through these multiple appointments, we're seeing those individuals over and over and have the ability to impact health, impact behavior, build a trusting relationship where we actually see that health improvement, whether that's in an A1C, a quality of life, a new motivation of empowering individuals that they are not alone. And so look at that team. We have a team there of nurses, educators, community health workers, physicians, both, you know, administrative and business coming together to bring an initiative, a service to our community that will last a lifetime, and that is tailored to individuals who are experiencing diabetes. And so with that, if we can go on to the next slide, what that also adds to their benefit as a resource. I always say, once you're in our family, it's never a goodbye, but how to keep you close. And so what we're doing beyond just the diabetes self-management is the opportunity to offer our patients and community wellness classes and different programs that are free and educational, that is diabetes, cardiovascular related, healthy eating, fitness classes that they can join, support groups and other resources. We cannot do this alone. We have many partners in the community who do health and well-being and different behavioral, motivational components of growing to learn how to live and manage a life with diabetes that is far even beyond our expertise. And we love extending that table. So having that support, and of course, keeping our community and our patients who are with us engaged. This is not one visit, it is for life. And that is something that we take great pride, but again, are able to elevate because of the regional partnership, because of the recognition from our health department, from our delegates, from our government in Maryland, that diabetes is something that one organization alone is not able to conquer. We must wrap around that as a community. And this is an ability and opportunity that we are able to elevate that to each and every individual who comes our way. Next slide. So how do you get involved? How can you be a part of it? We have the contact information of learning more about the diabetes self-management training program on your screen, and where to visit. And also we regularly send out messages, upcoming programs that are, a lot of our community programs are free and open to everyone. And we have those both virtual and in person. and of course, how to talk to your provider about getting that referral. That is really just the first step. And then from there, we will help you every step of the way. We are grateful to be with you today and hope and look forward to answering your questions. Thank you very much.
Well, thank you very much, Monique and Dr. Zibermint. That was really a fascinating presentation, and I was excited to learn so many of the things you shared with me. But I would like to now take this opportunity to move into the sort of discussion portion and the question and answer portion of the program. And my first question off the bat that I'm going to give to either of you who feels like answering is, can you tell me a little bit more about the program's impact in Maryland?
Absolutely. And thank you, Delegate Kelly. It is, we are going into probably that 6-9 month of actual operation. We had 1 year to ramp up to start that implementation. And what we are seeing in a short amount of time is that those appointments with our educators are filling up, that our providers, our community physicians are listening, and they are making those referrals to send their patients. And then the patients that are arriving are not only grateful, but they are already sharing with us their experience of life change, of both health and emotional motivation to be able to have that time with an educator one-on-one to learn exactly what is important to them. So we think of those sessions as educational and coaching, even though it has the word training in the title. We are here for the success of our patients. And so what overall we feel a success, but still room for so much more. And we have that capacity to grow. And we are looking forward also to building those greater relationships with our community physicians, who we want to make their job easier. We know what those lists look like and getting those primary care appointments. And how do we make our physician community, our provider community, elevate also the time that they're able to spend, because we're going to help them in that journey. So another great way that we build that continuum of care together.
Awesome. Anything to add, Dr. Zibermint, on the program's impact in Maryland?
Well, I think that the impact is obvious. I'll give a little anecdote. One of the patients who had to come back to Suburban Hospital recently told me that she had an amazing time spending one-on-one with the diabetes educator. And she said, guess what? She listened to me. I actually got a chance to tell her everything. I think she told about her in-laws and the family. But most importantly, the outcomes. Her A1C, this is a test which tells us how high her sugars in the past 3 months, has reduced by 1%. So she's making definitely a right steps in the direction of improving her diabetes. And that's the most important thing.
That's a great anecdote. Thank you for taking the time to share that. So my next question, what does the future hold, right? What are the upcoming plans and goals for this work in Maryland?
I'll start with that question. It's an excellent question. So we're constantly thinking about the future. One, we have to figure out how we are going to be sustainable program from a business perspective to make sure that we can sustain ourselves beyond the time when the grant money would expire. Another thing that we are working on, we are reaching out to local endocrinologists, especially for Suburban Hospital, mostly in Montgomery County, and telling them about our program. We're just sitting one-on-one with the providers and telling, hey, we are a wonderful resource. Please send us patients so we can connect with them. 3, we are excited, but it's still preliminary. We're hoping that we will be able to start providing virtual diabetes education to people who live with diabetes who are currently jailed in different facilities around Maryland. We are working on this, but we are hopefully this is something we will be able to happy to share with you the results of our work maybe just in a few months.
Wonderful. Thank you for that. I have two more questions and then we're going to open it up to questions from the audience as well. But my next question is really about state policies. Are there ways that state policies have helped make diabetes prevention efforts more successful in Maryland already? Are there things we've been doing right at the state level?
Thank you, Delegate Kelly. I will just start again with that. Thank you. This regional partnership is that. It is the answer. And again, it's with a 5-year opportunity to be able to learn, to establish those best practices. As Dr. Zibermint mentioned, at the end of the day, it's also how to complete that business model that's sustainable for all. And then to take those ideas and share and replicate. So I think, that is that we are grateful for the state for doing that. And I think diabetes has been on that elevated level for years. And this shows the actionable component of that. And again, I mentioned we are not the only hospital. We are not the only health system doing this. Many organizations, other hospitals are doing this across the state. And so I think how we continue that support, that it goes beyond that 5 years to look at how we put that into infrastructure, how we build that in to influencing health plans, and how we work with our payers as well.
I see you nodding, Dr. Zibermint. Did you have something to add?
Yeah. So if you'll ask me what are we going to do? What can you do for us?
I was about to ask you, how did you know? That was my last question. What state resources are necessary in the future to enhance this really important work that you all have been doing? I would love to know.
Yeah, I think that, well, first of all, thank you for giving us this opportunity to share our story. But it's really important for us to ask you to continue to expand the coverage options for people who live in Maryland, to make sure that all residents can continue to monitor their health, to make sure that there are also good public communication about enrolling into government programs such as Medicare and medical assistance or Medicaid, and make sure that the private insurance company would also maintain adequate networks. That's one. Two, we need your help with funding of the safety net clinics for people who are uninsured or underinsured. For example, Suburban Hospital is partnering with a mobile med clinic. So this is extremely important to us because this is the health of our community. Also, something that I'm personally passionate about, I bike to work every day. This is my commute. So I think we need more safe bike lanes in the area in Montgomery County. And also with the bike lanes, we also have to promote the healthier behavior in our community where we live. So it would be great to have some additional funding for safe and attractive places, maybe some for active recreation and fitness such as parks. So thank you.
All wonderful suggestions. I really appreciate them, Dr. Zibermint, and I will take them under advisement as we move forward at our work at the state level. We obviously have parallel goals, and we're all trying to get to the same place. So I really appreciate the work that you all have been doing. We do have a question in the chat, so let me see if I can read it to you all, and we'll decide who wants to answer it. The question is, I understand these resources are geared for folks with type 2 diabetes. Would they work for those with type 1?
I can answer the first question. So absolutely, yes. So obviously type 2 diabetes is more common, it's more prevalent. Of all the people, probably about 90% have type 2 diabetes and about 10% have type 1. But it was just recent data presented at the European Diabetes meeting just last week showed that the prevalence and the frequency of type 1 diabetes is increasing, and we suspect by 2040, the number of people living with type 1 diabetes is going to double. So yes, if you have type 1 diabetes, please call and we'll be happy to see you.
Wonderful. Next question is, how does Maryland's diabetes prevention experience compare to other states?
I would say that I'm not familiar what the other states are doing. I think as we really we're in a momentum phase of really that ramp up and seeing, having a wide angle view of what this looks like. But that is an excellent question, because I think it really is important to continue to look about what other states are doing, both for a benchmark and, as we look ahead of what's next. So that is, something that, I will be looking forward to, and that is great homework in terms of being familiar with what is going on out in the country. I tell you, we've had our heads to the ground a little bit here with ramping up our initiative and making sure that we are building access for all of our Marylanders. But absolutely, I love that as a part too.
Wonderful.
May I answer? May I add
Please,
something?
Dr. Yeah.
Yeah, so I see it on the American Medical Association Diabetes Prevention Committee, and I also sit on a few national committees for diabetes. And I want to say that Maryland is truly an innovator in the diabetes prevention. We are ahead of the game. There's some diabetes prevention programs around the country, like for example in Pennsylvania and Philadelphia, but we're all little pockets. This is truly a state-funded grant, large grant to advertise and promote diabetes prevention. So I think we're ahead of the game.
I agree with you, Dr. Zibermint. Absolutely. And we are very thankful for that.
I love hearing that. In Maryland, we like to be a leader. We want to be ahead of the game. We want to be a model for other states. So that is very exciting to hear. And we definitely congratulate you all on your work in that space. I don't see any more questions in the chat. I want to make sure that anybody who has a question has the opportunity to ask it. So one more shot. If you would like to type something into the chat, we will take questions. And while we wait to see if there are any more questions, I'll just ask Monique and Dr. Zibermint if they have any sort of closing thoughts they would like to add.
Dr. Zibermint, just going on a little bit to that point of Maryland, that you being ahead of in the country. Again, another note that through the regional partnership grants that are made possible through the HSCRC, this is the second one that I've personally been able to experience. And I will say that to be able to have that opportunity to think outside of the box, to look ahead with evidence, and to put that into practice as hospitals, to experience what, reducing utilization, making sure that we can, our community can pass by the hospital altogether and enjoy quality of life, really is innovative and going beyond, what I think other states are experiencing, and what it does for that workforce and us as a community continues to inspire change. And so I would just also to encourage that, because it gives the opportunity to build those partnerships in an environment that would not be made possible, especially as nonprofit hospitals, all of us in Maryland, would ever be able to do without that. So I did want to add that in there. And it's our residents who are really benefiting from that. Absolutely.
I agree with you, Monique. I want to add a clinician perspective as well. I think people who live in Maryland should be their own best advocates. Remember, diabetes is extremely prevalent, and most people don't know that we have diabetes. So the next time you're going to see a primary care doctor or a family practitioner, or maybe your GYN doctor, just say, hey, can you test me for diabetes? I heard that it's quite common. And you may discover that you have diabetes, so borderline diabetes. So if you have a borderline diabetes, then there is an opportunity to prevent it. So call us and be able to help you.
Thank you. I think that's a wonderful way to end this conversation. I want to thank everybody for joining us. I really want to thank both Monique and Dr. Zibermint for your work in this space and your efforts to address the challenges of diabetes while improving education access, optimizing communication, behavioral management, and stakeholder involvement. It's really wonderful to hear this story. As a member of the Maryland General Assembly and the vice chair of the Healthcare Committee, I'm honored that we have such a program in our state, and I'm proud to support the efforts that incorporate the needs and goals of people with diabetes into a personalized plan that has been proven to improve health outcomes. That's wonderful. I'd like to thank those of you who tuned in to listen to the conversation in the Showcase series. Johns Hopkins Government and Community Affairs team will host more of these events in the future, highlighting the anchor institution's relationship to Maryland. If you have questions, please email gca@jhu.edu. And with that, I would say thanks to everyone for joining us. Have a great day.